After you've had a dental implant placed or multiple dental implants placed, there's several postoperative steps that are important. You will have sutures in your gum tissue which will dissolve on their own, and that can take anywhere from 1 week to 3 weeks depending on the type of suture that's present. While those sutures are there, we don't want you using a toothbrush, because if you're rubbing with a toothbrush, that could rub the sutures free. So there's a few things that we have the patient do during the healing phase. We will have you take antibiotics and also provide pain medication if necessary. As far as keeping the gum tissue clean, you will be sent home with a bottle of mouth rinse, which is typically in a brown bottle such as this. The patient will use about half of a capful of the mouth rinse every morning and every night. You swish with that for approximately 30 seconds and then spit that out. This keeps the area very clean and ensures that your implant has the best chance of healing without problem. If a person is here having multiple teeth taken out and having an immediate denture placed, there are several steps that are important regarding your healing. When a denture is placed immediately after extractions, the gum tissue tends to swell over the first few days. It's important that the denture is not removed during this period of time, because if it is left out any length of time, the gum tissue swells so much that you can't get the denture back in place. You typically will need to see your dentist sometime in the first 2 to 3 days after the surgery as well, and this can be coordinated with our office contacting your general dentist's office. Occasionally we will receive a phone call later the day of the surgery and the patient has questions about bleeding. Just like if you cut your skin, if you hold pressure on that, that will slow the bleeding process down. We will send gauze home with you after your surgery, and by putting firm pressure from biting against the gauze and holding that, you're less likely to have problems bleeding. Some people want to spit, but that creates a vacuum in the mouth and therefore makes the bleeding process longer. So your best bet is to put the gauze in, bite for approximately 30 to 45 minutes, and change the gauze as needed. This typically is continued from the morning of the surgery into that afternoon. By late in the afternoon, most patients are not needing the gauze anymore, but occasionally a patient will need to sleep with gauze in the first night. If your bleeding continues or is at a rapid rate the following day after the surgery, we would want you to call our office for further instruction. After the implant has been placed, patients often wonder when they are supposed to contact their dentist. We will be seeing you at the 2-week post-operative point, as well as 3 to 4 months after the implant has been placed. You will not need to contact your dentist, because we will do this for you when the time is ready for the implant to be restored.